Irregular menstrual cycles are associated with shorter lifespans. A study published in the BMJ found that irregular menstrual cycles may be correlated with shorter lifespans. Regular menstrual cycles depict the normal functioning of the hypothalamic pituitary ovarian axis. This is a vital sign of a woman's overall health. Irregular and long menstrual cycles are associated with a functional disruption of the hypothalamic pituitary ovarian axis. The disruption is common among women of reproductive age. The authors involved 79,505 premenopausal women without a history of cardiovascular disease, cancer, or diabetes. The participants also reported the usual length and regularity of their menstrual cycles between the following ages: 14 to 17 years, 18 to 22 years, and 29 to 46 years. During the 24-year follow-up, 1,975 deaths were documented, including those who died from cancer and 172 from cardiovascular disease. Participants who reported always having irregular menstrual cycles had higher mortality rates during follow-up than women who had regular cycles in the same age ranges. Women who reported that their usual cycle length was 40 days or more at ages 18 to 22 years and 29 to 46 years were likely to die. Meanwhile, those that had a usual cycle length of 26 to 31 days in the same age ranges were less likely to die prematurely. According to the authors, these relations were more prevalent for deaths associated with cardiovascular disease. Younger women were likely to die from cancer but not from cardiovascular disease. In older women, the risk of death from cardiovascular disease was higher. Among current smokers, higher mortality was correlated with long and irregular menstrual cycles. Misclassification for recalled menstrual cycle characteristics at ages 14 to 17 years and 18 to 22 years is still expected, the authors acknowledged. Some exposure misclassification might be present as cycle regularity depended on the participant's interpretation of irregular. Additional studies that expound on these results will integrate knowledge of how menstrual cycle characteristics affect women's health. The researchers said this knowledge will help identify potential risk management interventions. Primary care providers should include menstrual cycle characteristics throughout women's reproductive years. These characteristics will serve as additional vital signs in evaluating the general health status of a woman. Noting the characteristics will determine potential lifestyle interventions to manage risks of menstrual cycle disorders that might have long-term complications. Senior author and associate professor of medicine at Harvard, Dr. George E. Chavarro shared his thoughts about the findings. The associations are not only limited to polycystic ovary syndrome or other gynecological or endocrine conditions that might cause irregular menstrual cycles.